Okay, so I think we can get started now. I just want to welcome everyone, especially if you're new to our Clean Cities meetings. We have a really great program for you today. So let me share my slides to get this started. Can you see my slides, or did I pick the wrong thing?
Originally, and then you switched to the other screen. So the first screen was the right one, I think. There you go.
All right. Okay, so today we're going to be talking about the road to better health and how transportation can affect our health and ways that we can address that with alternative fuel vehicles.
Hey, Nicole.
Yes?
Just wanted to let you know we have both your notes and your slides up there.
All right. Technical difficulties, I guess. Let's try again.
And while Nicole's doing that, just a reminder, please go ahead and put your name and organization and your role with that organization in the chat. And that'll just kind of help us better understand who's attending and who's interested in this type of topic.
Does it look okay now?
Yep.
Okay, good, thank you. All right, so like I said, this is going to be a really great presentation. I'm just going to quickly do an overview of Clean Cities for anybody that's new here. And then first up, we have Dr. Jacob ALTHOLZ, and I'm sorry, I know I'm mispronouncing his name, from Nevada Clinicians for Climate Action. We also have Dr. JOANNE LEOVY from the same organization, and then we'll have Melissa Ramos from American Lung Association. At the end, we'll take questions for everyone, and then I'll cover some of our upcoming programs for Clean Cities. And we'll also have Kevin from Clark County's Department of Environment and Sustainability, and Will from American Lung Association that will be able to help answer any questions in the chat or at the end of the program. My name is Nicole. I'm with the Department of Environment and Sustainability. And again, thank you for joining us. Just a quick overview of Clean Cities. This is the project I'm working on for Clark County. It's a national network that's run through the U.S. Department of Energy. The goal of Clean Cities is to reduce petroleum fuels, and that's mostly done through 6 approved alternative fuels and through idling reduction. The purpose is, of course, to reduce dependence on foreign oil, but more importantly, to provide cleaner air and lower greenhouse gas emissions. There are currently 75 coalitions in the United States, but we have no representation in Nevada, so this is a really great opportunity for us, and Clark County is working towards a designation into the coalition. Why would we want to be joining Clean Cities? Well, first of all, there's funding opportunities that are available only to coalitions. It provides national recognition. Clean Cities Coalition's been around for 30 years, and it's a really great organization. And it would be, beneficial to have Nevada within this coalition. It's a collaborative space for the community, so that's really important. How we're viewing our coalition, we are inviting anyone from the community that's interested in alternative fuels, sustainable transportation, and it's a way to just learn from each other, increase capacity building, and provide cleaner air and fewer greenhouse gas emissions for our region. So we have stakeholder meetings quarterly. We also have these educational programs in months where there isn't a meeting, and anyone is welcome to join those. Anybody is considered a stakeholder. We, in particular, are interested in working with fleet managers, nonprofits, public organizations, or individuals that just want to learn more about sustainable transportation. You can participate in Clean Cities, again, through these quarterly stakeholder meetings. We just had one in January, and we'll be having another one in April that I'll talk about at the end of the meeting here. We have online programming like this. We'll be doing in-person events. You can join a working group. We're going to be having those soon, and anyone's welcome to participate in our working groups. And there's opportunities to support, present, and host, just like in programs like this. If you want to learn more, scan this QR code. It'll take you to our Clean Cities website. I'll have the QR code up again at the end of the program, or you can email me at this address here. So that's just a quick overview of Clean Cities, and then I will let our first presenter go. So Dr. Jacob ALTHOLZ.
Hi, everybody. I'm Dr. ALTHOLZ. I'm an emergency medicine resident physician here in the city. Joanne, if you want to pull my slides up, that'd be very helpful. Let's see. Maybe
1 second, working on it.
no worries. To give everybody a brief overview, me and our other two speakers are going to talk to you today about the health effects of air pollution at large, and then things that we can do in the context of the Clean Cities Initiative. I'm going to give the brief overview of the actual health impacts from the medical side, and we're going to start from there.
Does that work
Perfect.
for you?
Perfect. Yeah. So if you just want to skip forward to the next slide. We're gonna have a lot of conversation around a lot of this stuff, so I'm not gonna read this off the slide, but generally what we're gonna do is we're gonna talk today about what exactly the air quality in Las Vegas can look like, and then the contributing factors to that, and then what the actual effects of those individual components of the air pollution that we're talking about today have on health, and then what we can do about that moving forward. Next slide. It's impossible to talk about climate change and the health without kind of mentioning that there's a huge broad set of effects that it has. We often think of the extreme heat as the most typical for things like climate change and pollution, but there's also a number of other things like vector-borne illnesses, so things that are spread by mosquitoes essentially is what we're saying, and a bunch of other things. But today we're just going to focus on the top right, which you can see is the air pollution itself. And generally, the trend is always that as climate change worsens, so do the health effects. There's a lot of things that we were mentioning just now, but generally speaking, every single one of them gets a little bit worse every single time the climate gets a little bit worse. So let's start with air pollution itself, and then Jamie, you can just skip right next to the one. You don't have to click the link on this one. I don't know if anybody remembers this, the ionic breeze. I talk about ionic breeze a lot. You don't have to click on it if you don't want to, because it's just a commercial. If anybody is from the early 90s to late 2000 or early 2000s, I should say, there's this. I think Joanne, you might have clicked on it if you want to donate today.
Sure. So sorry.
It's okay. There was a very well-known commercial to everybody that was talking about this air purifier called the Ionic Breeze. And the way it worked is it had two electronic plates that were essentially always passing electricity through them with the goal of, in their words, capturing and taking out of the air pollution. But next slide, Joanne. Essentially what it was doing, it was just creating ozone in people's houses. And so it didn't have very good evidence in the first place for that. It was creating air pollution, or that it was taking care of allergens or something like that. But what it really did was it just created ozone, which is a very reactive chemical we're going to talk about today. It's also a major component of air pollution. And Ionic Breeze essentially got sued and eventually went into bankruptcy because of this. And so you'll still find people trying to sell these online on Craigslist, etc. However, it is essentially creating air pollution in your house, and that is how it works. Next slide. When we talk about air pollution, I think that we usually in these areas, we focus the conversation on the residential or the individual aspects, but like we're discussing here, there's a lot of other things that go into air pollution. And so I circled residential because I think that people always think that what can I do for my individual life, but there's actually major components that are something else. So industrial commercial is by far the largest contributor to air pollution, but transportation is right there alongside. And so when we talk today about things like electrifying vehicles, it's important to recognize that these things actually contribute a lot more than other components do. And so it's important to recognize this. This graph is particularly discussing particulate matter, which we'll get into. Next slide. air pollution can be broken down into a immense number of things, and the difficulty is that these different components of air pollution have different effects on our health. The other thing is that they don't come out in the same they don't have the same effects each, and they don't come out in the same ratio. So some things are much more some things contribute a lot more, for example, nitrous oxide and sulfurous oxide. Some things contribute a much more particulate matter, carbon dioxide. It all depends. And so when we start talking about air pollution, it's important to start breaking it down. Slide. Today, we're going to spend most of our time talking about two categories. The first of which is particulate. So particulate air pollution is, I think, the most accessible because it's essentially stuff. It's just like stuff in the air. So dust or ash or something like that. And generally, we talk about this in terms of particle size. So when we discuss particle size, there's PM10, which is 10 micrometers or less. And then there's PM2.5, which is 2.5 microns or less. The differentiation there is important because the health differential is essentially the PM10 is filtered out a lot more easily because of the size of the particles itself. Whereas when you talk about PM2.5, that actually has the ability to enter through things like your bloodstream when you breathe it in. And so things like that are much more important to differentiate between. They both still have health effects. However, Joanne, next slide. PM 2.5, because it can get in your bloodstream, is essentially much more dangerous. And so in the short term, it leads to things like increased cardiac concerns. So people like MI is referring to heart attacks, and CHF referring to heart failure exacerbations. We can see spikes in admissions for other pulmonary related things. So pneumonia and COVID, we see a spike in the admissions for those diseases because in tandem with the increase in pollution in the air. And then overall, what we refer to as non-accidental mortality, which is just the overall death rate from things that are not related, for example, car accidents, increases when the PM 2.5 is particularly high on a given day. Long term, these effects can accumulate. So we see a lot higher rates of things like lung cancer, decrease in lung function. We see a lot more heart attacks and ischemic heart disease. We see strokes. We do see cognitive impairments, particularly in the children and the elderly. And then, for example, children have poor impulse control and academic performance. And again, overall non-accidental mortality goes up. Next slide. When we talk about ozone, I think that people are used to seeing this image, kind of imagining ozone as this thing that exists up way above the sky. So like the ozone layer, and talking about the CFCs, which really is one of the most impressive forms of international collaboration as far as protection of our environment goes. When we ban the CFCs, the ozone layer has largely returned, and that's important because the ozone protects us from certain UV light, and that took some time. However, next slide. There's a lot of parts to ozone that are not as fun. So ozone is great up there. It protects us from the UV. The fact that it's reactive is actually why it protects us from the UV. But that reactivity is what makes it really dangerous for us on the ground level. And so when people refer to smog, they're usually referring to particulate matter and ozone combined, essentially. Usually that's the most broad air pollution that you would see, for example, staring over the valley. And so the smog that we see when we look over the valley or when you look over any major city is really the dangerous stuff that we can see to our health. Next slide. Ozone itself leads to similar effects: decreased lung function, more asthma exacerbations, more ED visits for the same amount of things, or for the same exact things, cardiac and respiratory conditions. We see increased cardiovascular death, and then over the long term, we can see increases in preterm birth and low birth weight as well. Next slide. These are two slides that are specifically from Clark County. You can see that ozone and particle pollution fluctuate as the year goes by, but overall things have actually been getting better for ozone since the early 2000s. Particulate matter varies, but as we'll discuss, there's some things that we control directly and some things we don't. Next slide. A lot of days in Vegas don't look too bad. So if you guys are ever just curious because you can see in the air in the valley, just Google Las Vegas air quality, and actually you'll see something pull up immediately on Google that's this, essentially. There are many sensors across the city that in real time will update and talk about the air quality. And so you'll see a lot of days don't actually look that bad. However, next slide. You can see there's a lot of days that look pretty terrible. This was a wildfire that happened almost 2 years ago. I remember this particular day because I was working in the hospital and the air quality was pretty bad. And even the staff started having like problems with like their own sinuses and things like that. I was actually in the operating room when that was happening. And everybody could just feel their sinuses getting clogged. let alone what was actually happening with the patients who are much more at risk than we are. Obviously, we're not here to talk about wildfires, but next slide. When you look at the average of the year, you can start seeing better trends, because I think that it's important to recognize that there's certain what we call sentinel events where like there's big swings in air pollution that we can't do anything about. I would actually point to a couple days ago with the dust storm that happened was a pretty strong increase in air pollution. However, that was because of the dust that was kicked up by the wind. But if you look at averages over the year, you'll see this is the Las Vegas Valley. Those grayed out circles are grayed out for a couple reasons, one of which is some of those are indoor sensors, so they're not as helpful. But you can start seeing areas where the air pollution is worse. So you can start seeing down by Whitney and the 43 compared to out in the middle of the Las Vegas freeway up on the north side, where there's not as much going on. There's a 9. I think that's important to differentiate because it shows that there's a contribution to the urban living environment itself. It's not just living in a desert that creates poor air quality necessarily. Next slide. And you can see this is another graph that shows some of the strongest areas are actually in the east side of the city. So the 218 is the east side of the city, where you can have a lot of industrial parks and concrete parks. And then you can start seeing this compared to, for example, Summerlin, where we have the 8 over there. And you can see that this really creates a disparity sometimes. So next slide. Generally speaking, at large, and this is true across the country and also in Vegas, air pollution impacts are more severe for Black individuals, Medicaid eligible population, and the elderly and the very young. Some of this is just because of the biologic predisposition for the elderly and the very young, but it also tends to be the neighborhoods that people live in tend to be predisposed for certain things. So for example, lower income people tend to live in places with higher air pollution. And so when we talk about air pollution, it's important to recognize that it also doesn't affect people equally. Next slide. I think this is Dr. Leovy's portion.
So thanks, Jacob. And I really want to thank everybody who's on the line and thank Clark County and Nicole for bringing this exciting coalition together. I'm a family doctor, and so I've spent my career kind of in pragmatic details and problem solving for people. And so I wanted to take that broad outline that Jacob just provided us and delve into a little bit more detail about health effects, particularly of particulate matter or fine particulates, and to kind of relate that to what's happening in transportation emissions, and to use it as a basis for us to start thinking about what sort of plans Clean Cities Coalition might make in terms of helping our air to be cleaner. So once again, that PM 2.5 is a term that's really important for us to understand, and it is a fascinating area of study because up until about a decade ago, I don't think there was a very wide understanding of the huge range of health problems that it could cause. But now we have a constant barrage of new data coming out, including some stuff just this month that I will share with you. And we really believe that even in the US, where we have fairly clean air compared to a lot of countries, particulate pollution causes 100,000 deaths per year, which is more than traffic fatalities and homicides combined. And yet it's somewhat hidden and not necessarily manifest to us. So I'm really happy that you're here learning more about what it does. So we can kind of divide, as Jacob said, we can divide particulate exposure into short-term exposures, which are things like wildfires or inversion layers that might last a day or a few days, compared to longer term over the whole year exposures. And there's data for both of those events. What we know is that even particulate inversion layer that increases pollution for just a day or two has implications right away. And that's one of the key messages, I think, is that air pollution has health effects locally and health effects that are immediate. And therefore, cleaning the air can help us locally in a very small area of space and can help us immediately. So what we know for short-term exposure is that mortality increases. That is almost certain. And there's a lot of data that emergency department and hospital admissions increase for lots of things, including heart problems, pneumonia, severe COVID, and other sorts of lung diseases. Over the long term, meaning average annual exposure, which is more of the types of emissions that we're thinking about in the transportation sector, where roadway emissions are fairly constant over time, there's a lot of data for various groups of people. In medicine, we're very often interested in studies that are what we call controlled experiments where we can manipulate one group and hold another group constant and directly compare those. Public health information like pollution studies obviously are more observational and correlative. And therefore, it takes us several studies and large numbers of patients before we can have reasonable certainty that what we're seeing is real data and not just something that might vary from time to time. So I try to categorize the effects as either likely, possible, uncertain, or certain, just so that you can get an idea of what the data is. So we're fairly certain that cardiovascular mortality and illnesses and hospital admissions from things like strokes, heart attacks, ischemic heart disease, very likely are related to higher levels of particulate emissions. Lung cancer, very likely. Some other cancers, as I'll discuss in a minute. And interestingly, a variety of neurologic and psychiatric effects are now linked to particulate emissions. Importantly, as Jacob mentioned, it's almost certain that there's an increase in overall non-accidental mortality that's correlated with the overall level of pollution in a community. For cancer, there are a couple of tantalizing studies. Women living within 5 feet of a major road where you could measure that they had long-term exposures to higher concentration of transportation pollutions had significantly increased risk of breast cancer. And another study in the US looked at the rate of childhood leukemia and suggested that that's also correlated with long-term exposure to roadway pollutants. Mental health, you know, we have a lot of concerns about mental health in our country coming out of COVID, and it's a hot topic. And we know that there are lots of things in society that are impacting mental health, and that we have a lot of challenges in dealing with mental and behavioral health issues here in Nevada. But I don't know if you're aware that there's a lot of increasing evidence that air pollution is actually correlated with poor mental health. Just this month, a study came out in the UK correlating long-term exposure to pollution with levels of depression. That goes along with other earlier studies in places like China and a couple in the US that relate pollution to higher rates of depression, anxiety, psychiatric admissions, and cognitive and decision-making performance. Because pollution is often correlated with the amount of green space and other socioeconomic determinants, this evidence is not quite so certain, but I think it's really tantalizing and interesting information. For children, we are pretty sure that long-term exposure to particulate pollution increases asthma incidence, prevalence, and severity, that even young, healthy people chronically exposed to pollution will have reduced lung function. And this is important because we can develop stronger lung functions throughout our childhood, but once we get to adulthood, what we've got for lung function is what we've got. You can't improve it anymore. So trying to protect children's lungs is really important. It's likely that pollution is correlated with learning problems like ADD, developmental problems, difficulties with impulse control, and even academic performance. There's conflicting data about whether autism is related to pollution. Here's a study showing, and the table's a little confusing, but basically the people within 75 meters of a major road or highway were significantly more likely to have asthma in the moment of the study, a history of asthma throughout their life, or be wheezing than people who lived far away from roads. And so, you know, the thought that this is a significant contributor to childhood asthma, I think, is fairly well established. For perinatal care, it is very likely that long-term exposure to particulates causes problems with developing fetuses, including low birth weight and preterm birth, and likely affects newborn lung function. There's pretty good evidence that neonatal mortality, including SIDS, is increased in babies born to women who have long-term particulate pollution exposure. In the workplace, there is a variety of information that pollution actually affects productivity and absenteeism. There's quite a bit of data from cities in China where we know the air quality is very poor, but also even in rural California, that days of increased ozone were correlated with lower productivity among farm workers. Conversely, things that we've done to clean the air have probably really improved workplace. What we think is that the Clean Air Act, the effects of that just in 2020 alone prevented 17 million lost workdays and a variety of lost school days. And here's a study out of Belgium. The table's a little bit confusing, but basically the tables on the right where it says lag 0 to 2 are higher pollution days. And what this showed was that in Belgium, apparently there's good data about who gets admitted for mental health complaints, and that on immediately following high pollution days, there was an increase in mental health work incapacity and mental health admissions to hospitals. So it may even include particulate pollution may even correlate with poor mental health function among workers. Here's a study closer to home out of Salt Lake City. And what this study did was that they took pollution monitors immediately outside a variety of schools. So it was measuring hyperlocal pollution levels. And they measured this over about a year and correlated the amount of pollution in a local school area with absences. And they could follow an inversion throughout the city. If one area of the city of Salt Lake City had higher pollution at one point in time, they could see that the school absences the following day increased. And that the higher the pollution level was, the higher the absenteeism. Because low-income schools tended to be situated in areas of high pollution pockets, low-income students were disproportionately affected. And when you consider that parents have to take time off work, learning is lost, the school district doesn't optimally use their fund, they calculated that just reducing Salt Lake City pollution by 50% would save $426,000 a year in lost wages and economic costs related to school absenteeism. So trying to bring this home to Clark County, I'm interested in questions and reflections from those of you on the call, because I know that there's a lot of expertise on the call. And what we know is that Clark County is growing. Vehicle miles traveling are increasing. They've increased over 40% in the last 17 years. Nationally, 11% of public schools are within 500 feet of a highway. How does that relate to CCSD schools? And do we have many schools here where our students are vulnerable to roadway pollution? Thinking about other climate indicators here in the county, we know that our heat is increasing. And as Jacob mentioned, ozone emissions are related to increased heat and are predicted to increase. How can we plan for that? Heat also is a threat multiplier. So extreme heat has its own set of serious health implications. And when you pair a day of extreme heat and a day of poor air quality, we have a multiplying of risk in terms of heart disease, lung disease, behavioral problems, and perinatal problems. Additionally, we know that as we are increasing heat and we're also having more extreme weather, that our transportation sector could be vulnerable. And so that might be another thing for us to think and talk about. We already know, as Jacob mentioned, that both our ozone and particulate pollution in this area have improved over the last 10 to 20 years. And we can actually measure life expectancy gains related to that. And what we can see if you look at Clark County there on the map is that on average, all of us have gained about 1 to 2 months a year of extra life between 1999 and 2015 due to the Clean Air Act and related acts that have reduced the pollution that we otherwise would have had. And we know that if we switch from gasoline and diesel powered fuels to alternative fuels, we can save lives, and this can be quantitated. And I know that Melissa will talk a little bit more about this, but nationwide, we think that we would avoid over 100,000 deaths in the next 20 years if we could switch vehicles to alternative fuels. We would avoid a lot of asthma, a lot of lost work days, and that we can quantify the cost savings and health benefits, and it's a huge number. So this is a webinar about alternative fuels, but I actually think that thinking about transportation health effects, we also should think beyond just alternative fuels, and there are some co-benefits that are a little bit broader. Emphasizing mass transit can actually help health by cutting traffic fatalities a lot. Active transportation, which is walking or biking or I guess skateboarding to get to where you need to go. There's a lot of evidence that I'll share in a minute that reduces a lot of chronic disease measures. We know that commuting, long commutes are associated with mental health effects, and reducing self-driven car commutes, long ones, may reduce anxiety and depression, and that we can have a benefit for outdoor recreation and tourism if we have clean air. In terms of urban sprawl, it's actually been quantitated. This graph on the left shows counties throughout the country with the tighter counties with less sprawl at the bottom, like New York, and more spread out counties at the top. And what this shows is that people in more spread out counties weigh about 6 pounds more on average than the people in the more compact counties because they're doing more car commuting. Likewise, they have about a 2.5% higher rate of high blood pressure in the more spread out counties. So we can actually measure health effects from sprawl. And you can measure that in terms of economics. If you think about premature mortality related to traffic congestion, that there's an actual cost to that. And that if we're able to reduce congestion, that we can reduce the costs. We know that active transportation like walking and biking benefits chronic disease. And what this funny little graph shows is that you can see a downward curve toward the right. When you increase the number of people who commute by bike or foot, there's fewer of them that self-report as being obese. And there's a pretty clear correlation there. This is in the US and in other European countries. Likewise, when you increase the percentage of people commuting by bike or foot, you reduce the share of diabetes in a community. In San Francisco, they did a modeling study that showed just a small amount of increase in active transportation, just going from 4 to 22 minutes a day, would reduce diabetes and cardiovascular morbidity by 14%. And in our world, this is huge. There's very few pills that can reduce mortality by 14%. There's almost nothing that we can do in terms of traditional medical care that can have that kind of impact. Additionally, it would reduce traffic-related injuries and deaths. It would reduce greenhouse gas emissions, and there would be a trade-off because bike fatalities would increase slightly, but that would be more than offset by the benefits in other areas. Just changing to low carbon fuels without thinking about sprawl, roadway patterns, active transportation, mass transportation would reduce greenhouse gas emissions by a lot, but would actually have a lower impact on mortality because we Americans need to move more, and whatever it takes to get us to move is helpful and healthy for us. Finally, as I think most of you are aware, we know now that clean energy is generally cheaper than carbon-related energy, and we know that we can have economic growth here in this state without increasing emissions. And in fact, there's a decoupling. And what this shows is that Nevada was one of the top states in the country, about 7th on this list for decreasing CO2 emissions while still increasing our GDP. And reducing emissions can save money. So the Clean Air Act has been quantified as having about $2 trillion in cost savings in the last 30 years, mostly due to the health benefits. The costs of implementation are outweighed 30 to 1 by the financial benefits on health. An economic modeler named Drew Shindell out of Duke University has done some great work, and he showed that if we were to reduce emissions sufficient to try to keep global warming under 2 degrees centigrade, we would actually save $700 billion a year and 1.4 million lives over 20 years. And the great thing about it is that what we do here locally will save lives locally because we can reduce pollution here and now. That can have immediate health impacts, and the cost savings will be immediate for us and locally held. So thanks so much for listening. This is our new organization of health professionals. Information is on the website at nvcliniciansforclimate.org, and I'd be happy to communicate with any of you later on. Thanks so much.
Thank you, Dr. LeOvy. That's a great presentation. Up next is Melissa Ramos from American Lung Association.
Okay, thank you. Can you see my screen okay?
Yes.
Okay, perfect. All right. Hi, everyone. My name is Melissa Ramos. I'm the Senior Manager for Clean Air Advocacy with the American Lung Association. Thank you for taking the time to join us today. Today, I'll be covering Nevada's current state of the air, as well as how electric vehicles can essentially reduce air pollution and protect public health. So every year, the American Lung Association releases a State of the Air report in April. This year's will be coming out on April 19th. But our report essentially covers our exposure to two of the most widespread and harmful air pollutants, ozone, which is more commonly known as smog, and it essentially acts as a sunburn to our lungs, and then particle pollution, which is more commonly known as soot. That can come from a variety of things, as Jacob mentioned. So it's from like dust, construction, diesel exhaust, all these things in the air that can also threaten our health. So using the data from US EPA, we found that more than 4 in 10 Americans are living with unhealthy air pollution. This is the equivalent to about 137 million Americans. And people of color are disproportionately impacted from unhealthy air. They are actually 3.6 times as likely than white people to be living in a county with 3 failing grades on all 3 categories of pollutants. So that's ozone, short-term particle pollution, which are those unhealthy spikes within a 24-hour period, and then annual particle pollution levels. People of color are also more likely to be living with one or more chronic conditions such as diabetes, asthma, or heart disease. And again, that makes them more susceptible to the health harms of air pollution. So as we're seeing now more than ever, we're seeing increased drought, destructive wildfires, extreme heat. All of these conditions are degrading our air quality and increasing the risk of air pollution harming health. Our 2022 State of the Air report covers US EPA quality assured data from the years of 2018, 2019, and 2020. These 3 years were among the hottest years globally on the record so far. So again, because climate change conditions are worsening, we're seeing more of those health impacts worsening as well. So clean air and a safe climate are critical for healthy lungs. And Nevada, especially Clark County, has made significant progress to improve air quality. But as I mentioned, we're seeing more of those climate conditions that are driving up our pollutant levels. So both Las Vegas and Reno still rank high among the top 25 most polluted cities list. And in fact, the Las Vegas area in the 2022 report saw the greatest increase in short-term particle pollution levels. So breathing in air pollution, as Dr. LEOVY and Dr. ALTHOLZ has mentioned, can harm many individuals, including healthy adults, through various respiratory and cardiovascular symptoms. So whether that's increased asthma attacks, worsening of COPD, lung cancer, premature death, as well as other heart attacks and strokes. And in fact, the Health Effects Institute came out with a study that showed traffic-related air pollution being linked to early death because of cardiovascular disease, and also a strong link between lung cancer, mortality, asthma, and other respiratory infections in children. So now, as you've heard for a while, the different health impacts of air pollution, I'll kind of go over how electric vehicles can play a role in this. So we released our EV report, which is called Zeroing In on Healthy Air. And this looks at a transition to zero emission vehicles, as well as zero emission electricity. So our modeling looks at all 100% of passenger vehicle sales to be completely electric by 2035. And then for all medium and heavy duty vehicle sales to be electric by 2040. And using both of these modeling data, as well as 100% non-combustion by 2035, we could see over $1 trillion in public health benefits. And for Nevada specifically, this transition would mean $7.5 billion in public health benefits, over 14,000 avoided asthma attacks, hundreds of avoided deaths, and almost 80,000 avoided lost workdays simply by cleaning up our transportation sector as well as our electricity sector. So exposure to traffic-related pollution is a serious health hazard, especially for those living in community with heavy truck traffic. The mixture of emissions has been linked to poor birth outcomes, reduced lung and cognitive development, worsening of chronic respiratory and cardiovascular diseases, increased risk of dementia, cancer, and premature death. Heavy-duty vehicles represent such a small fraction of total on-road vehicles, but they also represent the greatest source of these pollutants. In 2020, heavy-duty vehicles represented approximately 6% of total vehicles on the road, but they generated 59% of ozone and particle-forming NOx emissions and 55% of the particle pollution. EPA also found that 72 million Americans are living in close proximity to heavy trucking corridors. These people are also more likely to be people of color and have lower incomes. So we took our EV report a step further to isolate the benefits of our data just on the trucking sector. Delivering Clean Air is a review of the truck sector emissions, including the benefits of a national non-combustion electricity grid. So the new report illustrates the potential benefits if all medium and heavy duty vehicle sales were to be completely electric by 2040, as well as a non-combustion electricity grid by 2035. And another factor that we took into this report is looking at all US counties that have major truck routes. This would qualify for counties that have a minimum of 8,500 truck trips per day. So in counties with major trucking routes and the transition to zero emission would result in $735 billion in cumulative health benefits, 1.75 million in avoided asthma attacks, and 8.5 million avoided lost workdays nationally between now and 2050. And for Nevada, again, I've highlighted the benefits here. So we could see 5.2 billion in public health benefits simply by cleaning up our truck sector as well as our electricity sector. So in order to make clean air a reality for Nevadans, it's important that we're making strong investments in zero emission technologies to clean up our most polluting sectors, which is both transportation and energy. As I mentioned before, cleaning up our light and heavy duty vehicles as well as clean electricity would mean $7.5 billion in public health benefits for Nevadans, and 5.2 billion of those public health benefits come from cleaning up the medium and heavy duty truck sector alone. So here are some of the key policies that we're really pushing for here in Nevada. And I think, as I mentioned, one of the greatest ways that we can improve, make these benefits a reality is really by accelerating our zero emission infrastructure. This includes charging stations as well, and incentivizing the adoption of electric state fleets and supporting programs that would reduce transportation emissions across the board. Sorry about that. But essentially, we want to make sure that we're looking at different ways that we can incentivize mostly the adoption of electric state fleets, because we know, as I mentioned, transportation is the largest source of our air and climate pollution burden. So if we're able to make these investments now, we can really make these public health benefits a reality for Nevadans today. So now I'll just open it up for our Q&A session.
Thank you, Melissa. That was great. There's actually a question for you in the chat from Carla, and she asked, what about hydrogen cars? I'm assuming that your report only looked at EVs, but I just wanted to see if you had any information on hydrogen.
Yeah, our report specifically looked at electric vehicles and I believe plugins as well, but I have my colleague Will Barrett on the line who can tell you a little bit more about what modeling we used and what vehicles we're looking at.
Hydrogen cars too have a long way to come in some ways. They're something that I think people are optimistic about, and they in theory burn hydrogen to create just water essentially as the I guess the exhaust, it's just water essentially. That being said, it depends on a couple of things, one of which is we can't ignore where that energy comes from. So where the hydrogen itself comes from is different. So when we talk about electrifying vehicles, it's important to tie that into how we get our electricity in the town. The hydrogen vehicles are not as advanced. I wouldn't say as advanced. It's a complicated question, but they're not as far as we have seen, whereas electricity is readily available. But anyway, if somebody has further elaboration.
Hi, everyone. And this is Will Barrett with the American Lung Association. I was part of the team that worked on the report that Melissa just walked through. And specifically, we looked at battery electric vehicles as kind of our key modeling device for the study. And to Jacob's point, yeah, I would agree that on the passenger vehicle side, there's been very limited deployment of hydrogen vehicles to date. The battery electric sector has really come along quickly and, at cost parity in a lot of ways with combustion vehicles. We just haven't seen that on the hydrogen side. I think on the heavy duty side, there's probably more opening for hydrogen, but with all the caveats that Jacob mentioned about sourcing the hydrogen and making sure it's actually, not just a fossil fuel, product in the end. So hopefully that helps, but thanks.
Yeah, I have a question on when we're talking about sourcing. Is your guys' studies are very interesting, but what about the studies associated with mining of the rare earth minerals to source the EV component? Has there been any studies on the impact of the increase in the mining and environmental impacts of that around the world?
There certainly has been. There's certainly a lot of actual research into this. The difference is that, much like I was saying at the beginning of the talk, the effects are often much different than we're talking about with the air pollution. So the rare earth metal mining operations, of course, have air pollution components to them as well, but often the effects are related to things like runoff and what the actual environmental destruction is, depending on where those mines are. And so when it comes to this, we've talked a couple times now about the idea of sourcing. I think it's very important to keep that in mind. I think that though the effects are they're not as tied to air pollution as they are to other parts. And I see somebody in the chat, Sarah, if you would very much like to put that in, if that's regarding, yeah, so there we go, for the mining effects.
I mean, not just the mining, about the processing as well. I mean, is there any studies shown? I mean, you guys do a great job showing air pollution in Nevada, Clark County, and around the country and everything. That's great. But sourcing, processing, mining, it's just more than just mining. I would like to see studies associated with that if possible.
I'll just say I'm not familiar as much with the rare earth metals. I haven't looked as deep, if anybody else has any.
Well, I think it's very important to consider, because the rare earth minerals is what constitutes lithium ion batteries, which is what is found in EVs. So you can't push EVs on everybody without taking the product of mining and processing the sources for EVs.
I have a link from the Union of Concerned Scientists, and they looked at the total life cycle of a standard vehicle versus an EV. And the total life cycle for that vehicle, they still have lower greenhouse gas emissions for an EV by like 52% than a standard vehicle. I don't have anything in particular on any of the other types of pollution, but I can, if you want to email me, I can try to help you find any information on that.
All I'm saying is that we're processing information and reporting on air pollution, which is great, and reducing it, but across the globe, as you mine these rare earth minerals and process them into the batteries for EVs, I have not seen a single study showing if we have these boisterous goals of by 2035 having all vehicles in the Clark County be electric, what demand does that put on the world as far as just sourcing the materials for it? And how much pollution is that going to create around the world, not just the United States, talking around the world, because it is a global initiative, correct?
I mean, every region has their own sustainable transportation goals, so it's hard to say,
So we're just only concerned about Clark County, US, not the rest of the world?
I mean, oh, go ahead.
Yeah, I was going to say, I can speak to that a little bit. You know, Clark County is thinking about reducing our emissions locally and globally. You know, we're contributing in so many different ways. This particular webinar is really focused on the air quality and the health effects that come directly from emissions from vehicles. And I don't know if you were here in the beginning, but, you know, we talked about alternative fuels that include a lot of different things, which includes idling reduction and, you know, long-term planning. Also, Clean Cities is very focused on types of vehicles and that idling reduction, whereas Clark County's overall goals are related to so many different facets. So, you know, this, like I said, this webinar is very focused on the health and how it relates to emissions from vehicles. So, you know, of course, we're looking at all these other things, but that's an important piece to keep in mind.
Yeah, I would just like to, if somebody's got it, if this is a coalition, I would like to see a study associated with that.
Yeah,
Because
just send.
we're seeing studies associated with everything else except for the sourcing and processing of the materials.
Josh, if you want to send me an email, I'll be happy to discuss that with you. But if it's okay, we can move on to some other questions for maybe.
Did you want me to speak to that really briefly? This is Yusuf.
Oh, sure, Yusuf.
Yeah, so for what you're talking about, sourcing the raw materials, that's usually done through mines. For existing mines, depending on the jurisdiction, there's usually various types of permitting and compliance, whether that be for water or land use, for air emissions. For newly proposed mines, there's what they call an EIS, which is an environmental impact statement, which you have to get done prior to the permitting, and it depends on the size. Usually these could be major sources, so it depends on the size of it. And again, if it's in California, it might be a little bit different based on, you know, California requirements. It just really does depend on the jurisdiction, but there is overarching federal requirements that require permitting at certain levels for the extraction of these materials, including for air and again, land use and different types of waste management. So in the United States, that is something that is happening for the most part across the board. I can't really speak as much for internationally, but that is something that is covered to some extent. I wouldn't say 100% because, you know, nothing is perfect, but there are certain regulations in place for that.
I understand that, and I
Nicole-
understand environmental impact studies. However, with all these projections of how we're going to reduce emissions in 10 years or 12 years by 2035, 2040, I would like to see a study that shows how many emissions are going to be increased by the demand of the sourcing of the materials and processing of the materials. That to me
Josh.
is very relevant.
Josh, my name's Sarah Walkley. I'm just going to jump in really quick. Sorry, y'all. If you read the chat, I put my contact information in there. And the questions that you have, I also dropped a report that just came out a couple weeks ago that are beginning to address your concerns. So please feel free to reach out to me. This is a conversation that needs to be had more across the board, as you can see. So please, yeah, check the chat, Josh, and let's connect afterwards.
It looks like Steve Scott has his hand up. Did you have a question? Sarah has her hand up. Okay, Randy.
Yeah, I've got a comment. As we're going through this and environmental responsibility as everybody here, I think the technology has swayed for places that were bridging gaps to get us in places at times that would have helped years ago with hybrid technology if that would have moved forward more than it did instead of the full electrification rush. Number one. And the grid side of it, working for the power company, as we're striving to get closer to where we need to be to clean up. There's still the battery storage concern, which is a large volume of batteries to be able to offset those night times and the cloudy days and those other periods of time where we're going to have to support the grid. So just as we adopt and move forward in a lot of this stuff, the rush to be California is what I think everybody really needs to think about and consider before, because there's consumer impacts, there's a lot of impacts, and a lot of, as we talk about parts of the society that are impacted more by pollution, they will also be impacted by the increased costs of rushing as technology is evolving so much so quickly, to be cautious of taking the right steps and manage this as a long view, not looking at the hand in front of your face, looking out long term. I can remember the rush to get rid of paper bags and glass bottles, which are both 100% recyclable. How's the plastic bottle worked out for us in the plastic bag? So it's just a holistic approach that we got to be looking at, that impacts evenly and is long term going to really meet the goal and be the solution. That's all.
Well, thank you for sharing, Randy. It looks like we have 2 minutes left, so I have a question from Olivia, and she asks, how can individuals get more involved in promoting clean air, especially if we aren't health or sustainability professionals? Does anyone want to take that question?
Well, I think that, you know, the interesting thing is that we all are residents and we all can have health concerns. And it's fascinating to me as a health professional that I have a patient walk into the office with a health problem, and I actually, it's difficult to assess what proportion of that problem might be related to dirty air. So one thing that I think is very helpful to us in trying to promote clean air is to hear from people who actually are impacted, people who work outdoors, who work near roadways, who are affected by transportation emissions, who attend school or have children who attend school near a roadway, people that have heart or lung conditions. I think hearing stories and sharing stories is probably one of the best ways to raise public awareness.
Thank you. So I don't want to go over here, but I just want to wrap up and let everybody know that we'll have another webinar on March 23rd about idling. There'll be different types of idling reduction ways that you can, like through technology or through behavioral changes. So that'll be a really great presentation next month, but I wanted to thank Dr. ALTHOLZ, Dr. LEOVY, and Melissa Ramos for presenting today, and thank you all for joining us.
Thanks, everyone.